I have 15 minutes to focus in on only the patient's medical issues. And so I don't have to do documentation, I don't do administrative stuff, I don't have to worry about how to set up labs. The nurses do all that. I go in 15 minutes, I focus in on their medical problems. So the patients realize I touch all their medical issues, and then I understand what's going on, and it gives them a sense that I really am their doctor. And it's all because I've gotten more efficient. It's not because I'm better trained. It's not because I've done ancillary training to learn how to do different things that I never went to medical school. I'm doing exactly what I went to medical school and was trained to do. I'm just doing it very efficiently. That efficiency has reestablished the doctor-patient relationship for me and my patients.
Cardios.nm, musculoskeletals, the right shoulder and arm pain. Blood pressure is 141/81 and his weight's 145.
We will not change until we have to. In 2003, I came to the have to. I hated what I did. I hated coming to work. The nurses were not happy. I was not happy. Patients weren't happy. My front office was not happy. We were just here because we had to be here. And now all that's changed. But it took me 5 years to embrace this change, because it is a change in the way that doctor practices medicine. I see every patient. I'm involved with all the information the patient gives. I do the physical exam. And so, in a very real sense, I'm the one who's making all the decisions. But the nurses are very much involved in those decisions. So, from turnover standpoint, they don't want to go anywhere else, that they're not going to be used in this way.
What's your full-time MA and nursing staff altogether?
Well, I'm responsible for 3.5 clinical people, and up front I'm probably responsible for about 2.2 FTE positions in the front office. This is built around team function, and it takes you invest in your team. We would meet once a week for the first year, and we would talk. We'd go over issues. We'd talk about how to streamline the process. The nurses started giving their ideas. They started adding to everything in a tremendous way, things I never dreamed about, because you start bringing their thoughts and their energies into it, and their intelligence, and it changes everything. But that time of meeting once a week for a year, we meet every Thursday morning from 8 to 9, changed us from individuals working together into a team of individuals that had shared responsibilities, common goals, and really competent skill sets. And that's what makes a good team. Those three things build a team, and the only way that can happen is meeting together. Now we meet on a once-a-month basis. We don't need to meet every week.
What was the hardest part for you, Peter, in making this change?
Well, you wonder, well, can I be competent in this? Can I turn over things I've always done myself? Can the nurse do as good a job as I can? And the fact is, the nurse will do a better job than what you can. We don't have time. Physicians don't have time. It was after I've been doing this for a year, I presented this to my system, and I'm in a 300 physician group. And after I presented, one of the internists came up to me and said, "You know, Peter, I like what you said, but truthfully, there's no nurse who can take as good a history as a doctor." And I said, "You know, maybe I am crazy, but I sure like it. And I can't go back to the old way, so I appreciate your opinion." I would have told him 6 months later, there's no doctor who can take as good a history as a nurse. And it does not come down to intelligence, it comes down to time. I never have the time to get all the information that I want to get. Now the nurse does. And I'll give you an example of that. Now every year, a family doctor have 2 or 3 patients drop dead, totally unexpected. Now heart disease kills more people in America than anybody else. So, you know, I should have some kind of system in place to try to find these 2 or 3 people. Well, you can't ask every person that comes to the door, "You're having chest pain," because it's a very common symptom. So I never would ask. I never had the time, just something you have to live with. Well, now that the nurses are taking the history, I could start dreaming again. And so every patient over 50, we're asked 6 questions. You're having chest tightness, chest pressure, any discomfort in your neck or your shoulder when you go up steps or cut grass or carry groceries or vacuum. And then if you had any change in your breathing, any drastic change in your breathing capacity. And so every patient over 50 gets asked those questions. But we had a 62-year-old who came in, and he wanted a lesion on his scalp evaluated. So she asked him those questions. He said, matter of fact, I went up to steps twice in the last 2 weeks, and I got this tightness. Now, it went away when I got to the top, but it happened twice, and I totally forgotten about it. But now that you ask me, that did happen. So when I came in the room, she presented that stuff.
Yeah.
That guy got bypassed 3 days later.
Wow.
And he was sitting on a left main lesion. He had minimal symptoms, but he was sitting on a time bomb. That's happened to me twice now. The sense that doctors have the time to take a good history. We all live with the fact that we don't have the time, but we just don't recognize, because of the lack of time, we really are not taking a very good history. Now I can go back, Sue, and ask patients about the last 5 things I saw them for. Well, how's that dizziness doing? How's your back pain doing? How's that shortness of breath doing, whether it's physiologic versus pathologic? You don't know the pleasure that gives me to go back and ask them. The patients realize this doctor really does know my medical problems. And then also, from a malpractice standpoint, it covers the bases.